The first contestant is Janelle Austin, with a speech entitled An Ordinary Shift.
Contest chair.
An Ordinary Shift, Janelle Austin.
Nurses. We don't get paid enough, but gosh, we have some stories to make up for it. Let me tell you about a recent shift. It's the dead cold of winter. It's 7 a.m. in the tea room and we're huddled around our coffee on a Sunday morning. Now, we like Sunday mornings, penalty rates, bumps up the pay, and no management. And my shift gets better. I only have 3 patients and 1 student to help to teach. The first patient is Stevie. Now, Stevie's an asthmatic and she also happens to be blind. Then Marie. Marie, oh, darling Marie, she tripped over her cat called Ian and she broke her hip. And the third patient, Joe. Oh, Sleepy Joe. Sleepy Joe's got a slight touch of dementia and he's ready to go home though. So we're just going to give him a shower and then discharge him. So we commence our shift. Tom and I walk down to see Stevie. Stevie, hi, my name's Janelle and this is Tom. And we just want to see how you use your inhaler. Because quite often, the way that someone uses their inhaler could not be helping their asthma. Okay, so we walk in and I give her the inhaler. And Stevie looks at me and she's like, oh, okay. I thought this is a bit odd. She undoes the cap. We're off to a good start. Sometimes they don't. And then she starts rustling under the bed. And I'm like, what is going on? And then she lifts her gown, revealing her chest to Tom and I, and then she sprays into her chest. Stevie, do you mind telling Tom and I why you did what you just did? Oh, well, the doctor said it's for my chest. Toastmasters, the importance of communication. It is for her chest, but it is for her lungs on the inside of her chest, not her skin on the outside of her chest. So all we have to do is re-educate her and she should start settling down with the asthma. Oh, I hear my voice. I hear my name getting called. It's the anaesthetist. And I know this anaesthetist very well. He's very funny. He even sometimes uses the joke, you are getting very sleepy. So Marie needs a hip operated on and he's going to do an epidural. So what I need to do is just help hold her in this C-shaped spine to open up the bones in her spine so the anaesthetist can very gently and carefully get a needle in and relax her and, what's the word I'm looking for? Numb her legs. So whilst I'm down and I'm holding Marie, I also need to distract her from the pain. It is slightly painful, not overly. So we're chatting about Ian the cat and she's saying how he always gets under her feet. He can be quite annoying and she's not quite sure if she's going to keep him or not. And then the anaesthetist is like, we're done, you're done. And she looks at me and it's a bit hard of hearing. She said, what did he say? And I said, oh, Marie, he said you're done. And Marie said, oh, I haven't been done in years. We all have a giggle, and then I know that Marie is going to go to theatre and dream of a time before. Now for Joe. So as I said, we're going to give Joe a shower. So for those of you that don't know, or unfamiliar with the hospital chairs, they're the white plastic chairs and they've got the slats down the bottom. So the water drains and we don't get an infection control issue. So Joe's sitting on the chair, it is freezing, it is winter, so I warm the water up and we give Joe a very lovely warm shower. And then I say to Joe, I need you to now stand up so I can towel the back of you. So Joe goes, oh, okay. Joe goes to stand up and he doesn't move. And I thought, this is really weird. I'm familiar with Joe. I know he is mobile. What's going on here? Sometimes your skin can get sticky and stick to the plastic. So I thought maybe that's it. So I hold the back of the chair and I say to Joe, all right, try and stand up again. So I'm holding the back of the chair, Joe's sitting down and he goes like this. And this time he doesn't move at all because I'm holding the back of the chair. And then he yelps so in pain and I'm like, oh my goodness, what is going on? And Tom bends down. Tom turns a shade of white. His eyes are bulging out of his head. And I'm like, what's going on? I bend down as well. Speaking of bulging, Joe's testicles have fallen through the slats in the chair. So we started the shower cold and then they've fallen down and his nuts, his gonads, he is stuck to the chair. And Tom turns to me and he says, what, the shift? And I said, no, Tom, we've had a great shift. We've learnt the importance of communication. We have given Marie a wonderful send-off to theatre. And we have learnt to place a towel down between the patient and the chair next time we do a shower. And he said, all right, it was a pretty interesting shift. And I said, no, Tom, it was just an ordinary shift. Contest chair.